Right now, your kidneys are breaking down, and you have no idea it is happening. Medical researchers just found 7 everyday habits that are silently killing the kidneys of millions of Americans over 50. These are not the things you hear about. Number 3, it is in 70% of homes right now. And number 1, you probably did it this morning without thinking twice about it. That pill you take for heartburn. New studies show it can increase your risk of kidney failure by 72%. Stay with me because I'm going to walk you through all 7 of these kidney-damaging habits. And more importantly, I will show you exactly what you can do about each one. Before we start, hit that subscribe button and turn on notifications. I share health information like this every week that could make a real difference in your life. Now, quick disclaimer. Everything I share today is for educational purposes. This is not medical advice. If you have concerns about your kidneys or any health condition, please talk to your doctor first. All right, let's get into it. Starting with number 7. Habit number 7, proton pump inhibitors. Number 7 is something millions of people do every single morning without a second thought. You wake up. You feel that burning sensation in your chest. You reach for your heartburn pill, and you go about your day. Here is what most people do not know. Over 15 million Americans are taking these medications called proton pump inhibitors. You might know them as Prilosec, or Nexium, or Protonix. And new research shows something alarming. A 2024 study published in the journal Biomedicines analyzed over 1.1 million people. They found that long-term PPI users have a 72% higher risk of developing chronic kidney disease. That is nearly 3/4 more likely than people who do not take them. But it gets worse. Research from Johns Hopkins University tracked over 173,000 people taking these medications, and they found a 96% increased risk of kidney failure, so severe that it requires dialysis. Think about that for a second. Almost double the risk of needing a machine to filter your blood for the rest of your life. So, why does this happen? These medications do not just reduce stomach acid. They also deplete your body of magnesium, which your kidneys need to function properly. They cause inflammation deep inside your kidney tissue. And over months and years, this damage builds up. Now, I am not telling you to stop taking your medication. That is a decision only you and your doctor can make together. But here is what you should do. Schedule an appointment. Ask your doctor about alternatives like H2 blockers. These work differently, and studies show they do not carry the same kidney risks. If you have been on these medications for more than a year, ask for a kidney function test. It is a simple blood test that checks how well your kidneys are working. Now, number 6 on our list is something that happens while you are sleeping, and half of all seniors have it without even knowing. Habit number 6, sleep apnea. And the scary part? Most people have no clue it is damaging their kidneys while they sleep. Sleep apnea affects about 50% of Americans over 65. But here is the problem. Between 75 and 80% of those people have never been diagnosed. They have no idea anything is wrong. A January 2024 study in the journal Clinical Kidney Journal looked at patients who already had kidney problems. What they found was shocking. 57% of them also had sleep apnea, that is more than half. And here is how you know if you might have it. Do you snore loudly at night? Does your partner say you stop breathing while you sleep? Do you wake up with headaches? Do you feel exhausted even after a full night of rest? These are warning signs. When you have sleep apnea, your breathing stops over and over throughout the night, sometimes dozens of times every hour. Each time this happens, your oxygen levels drop. Your kidneys filter about 1/4 of all the blood your heart pumps, and they need a constant supply of oxygen to do this work properly. When your oxygen keeps dropping, it creates stress on your kidneys. Night after night, month after month. This repeated stress causes inflammation. It damages the tiny filters inside your kidneys, and over time, this leads to permanent kidney damage. So what can you do about it? First, talk to your doctor about getting a home sleep test. These are simple now. You can do them in your own bed. If the test shows you have sleep apnea, CPAP therapy can help. This is a mask you wear at night that keeps your airways open. Also, losing even 10 to 15 pounds can reduce sleep apnea symptoms. And try sleeping on your side instead of your back. This simple change helps many people breathe better at night. Habit number 5. Phosphate additives. Number 5 is hidden in plain sight. It is in your refrigerator right now, in your pantry, and most people eat it multiple times every day without knowing. A March 2025 study in the American Journal of Clinical Nutrition examined nearly 40,000 products from top food manufacturers. They found that 56% of packaged foods contain phosphate additives. Here is the problem. Your body absorbs 90% of phosphate from these additives. Compare that to natural food sources, where you only absorb about 40 to 60%. So these additives flood your system with much more than your kidneys can handle safely. And there is a labeling loophole. Only 3% of products list phosphorus content on nutrition labels. Where are these hidden? Processed meats, frozen dinners, bakery products, and cola drinks. Research from UT Southwestern Medical Center found that 1/3 of Americans consume 3 to 4 times the recommended phosphate amount daily. What does excess phosphate do? Your kidneys work overtime to filter it out. This constant stress damages them. The phosphate also builds up in your blood vessels, causing them to harden. This speeds up kidney decline. Read ingredient labels. Look for any word containing phos, phosphoric acid, sodium phosphate, calcium phosphate. If you see these, choose something else. Buy fresh chicken instead of enhanced versions. Choose block cheese over shredded. The shredded kind has phosphate to prevent clumping. And limit cola drinks. Number 4 connects a part of your body most people would never think affects kidneys. And 70% of seniors have this problem right now. Habit number 4. Gum disease. Number 4 is the connection most people never see coming. Your mouth and your kidneys. They are linked in a way that can be dangerous. About 70% of adults over 65 have some form of gum disease. But here is what makes this so serious. A December 2024 study in Nature Reviews Nephrology from the University of Birmingham found something remarkable. For every 10% increase in gum inflammation, kidney function drops by 3%. Think about this. Severe gum disease creates an open wound in your mouth about the size of your palm. That inflamed tissue gives bacteria direct access to your bloodstream. And only 40% of seniors see a dentist each year. So millions of people are walking around with this problem and do not even know it. When you have gum disease, bacteria from your mouth enter your blood vessels. These bacteria travel through your body, and they end up in your kidneys. Once there, they trigger chronic inflammation. Your immune system keeps fighting, and this constant battle damages the tiny filters in your kidneys. The study found it works both ways too. When kidney function drops by 10%, gum disease gets 25% worse. Brush your teeth twice a day. This is basic, but it matters. Floss every single day. Research shows people who floss regularly have about half the gum disease rate of people who skip it. See your dentist every 6 months for a cleaning and checkup. If you already have gum disease, get professional treatment. Scaling and root planing can reduce the inflammation throughout your entire body. Number 3 is about how you cook your food. And this one might be hard to hear because it involves some of America's favorite cooking methods. Habit number 3. High heat cooking. Number 3 is going to be tough for a lot of people because it involves grilling, frying, roasting. Some of the most popular ways Americans cook their food. Research shows that about 47% of American meals involve frying or grilling. And here is the problem. A 2022 study in the journal Diabetes Care tracked thousands of people. They found that cooking with high dry heat increases something called ages in your food by 10 to 100 times compared to the same food cooked differently. Ages stands for Advanced Glycation End Products. Think of them as toxic compounds that form when you cook meat at high temperatures. Your bacon, fried chicken, grilled steak, even roasted nuts. These all have high levels of ages. And here is what makes this dangerous. These compounds build up in your body over decades. Your kidneys are supposed to filter ages out of your blood. But when you eat them every day, your kidneys cannot keep up. The AGEs get stuck in the tiny filters inside your kidneys. They cause oxidative stress. They trigger inflammation. And over time, this creates irreversible scarring in your kidney tissue. A 2025 study in Cell Reports Medicine found that people who switched their cooking methods reduced their circulating AGEs by about 50%. Steam your vegetables instead of roasting them. Boil or poach chicken instead of grilling it. Use stewing methods for beef. If you do grill, marinate your meat in lemon juice or vinegar first. This can cut age formation in half. Keep your cooking temperature below 250 degrees when possible, and cook for shorter times. Now we are down to the final two. Number 2 is an environmental threat that 98% of Americans are exposed to right now. And number 1, it is the habit you most likely did this morning. Habit number 2, PFAS chemicals. Number 2 is something you cannot see or smell, but it is in your body right now. They call them forever chemicals, and scientists are finding them everywhere. A 2021 study from the National Cancer Institute found something disturbing. When they doubled PFAS levels in people's blood, kidney cancer risk went up by 71%. People with the highest PFAS levels had more than double the cancer risk, and nearly every American is exposed. CDC data shows that 97 to 98% of people have detectable PFAS in their blood. Where does it come from? Non-stick pans, food packaging, water-resistant jackets, stain-resistant furniture, even your drinking water if you live near military bases or airports. The problem is these chemicals stay in your body for 4 to 8 years. They do not break down. PFAS concentrate in your kidney tissue because your kidneys try to filter them out. But they cannot break these chemicals down, so they just accumulate. Year after year, decade after decade. A 2024 study from USC Keck School of Medicine found this buildup explains up to 50% of kidney function decline in exposed people. These chemicals cause DNA damage in your kidney cells. They disrupt your hormones, and they alter your gut bacteria in ways that make kidney damage worse. Get your water tested if you live near industrial areas or military bases. Install a filter certified to remove PFAS. Activated carbon or reverse osmosis work best. Replace old non-stick cookware with stainless steel or ceramic. Be careful with freshwater fish. Limit how often you eat them. And skip stain-resistant treatments on new furniture and carpets. And now for number 1, the habit that 95% of Americans are doing wrong. The one you probably did this morning without thinking about it. Habit number 1, low fiber intake. The habit that is damaging more kidneys than almost anything else on this list. And yes, you probably did it this morning. You ate breakfast without enough fiber. Only 5% of Americans meet the daily fiber recommendations. Just 5%. A study in the journal Kidney International analyzed over 14,000 people. They found that those who ate the most fiber had a 40 to 50% lower chance of developing kidney disease. Every 5 grams of fiber you add per day drops your kidney disease risk by 11%. Most Americans eat about 15 grams of fiber daily, but you need 25 to 38 grams. That gap matters more than most people realize. Here is what happens when you do not eat enough fiber. The good bacteria in your gut start to die off. Bad bacteria take over. These bad bacteria produce uremic toxins. Toxins like indoxyl sulfate and p-cresyl sulfate. These flood into your bloodstream, and your kidneys have to filter them out constantly. Low fiber also causes leaky gut. Your intestinal wall becomes damaged. This lets even more toxins pass through into your blood. The cycle keeps getting worse. Aim for 25 to 30 grams of fiber every day, but add it slowly. Increase by about 5 grams per week to avoid stomach discomfort. Eat more beans and lentils. Add oats or barley to your meals. Load up on vegetables. Drink more water as you increase fiber. Your body needs the extra water to process it properly. Studies show that people who get at least 25 grams of fiber daily have significantly slower kidney disease progression. So there you have it. 7 habits that are quietly damaging kidneys across America. The good news? Every single one of these is within your control. You can talk to your doctor about your heartburn medication. You can get tested for sleep apnea. You can read labels and change how you cook. You can floss your teeth and add more fiber to your meals. Now I want to hear from you. Which habit are you going to change first? Drop a comment below and let me know. If you found this helpful, hit that like button. It helps more people find this information. And subscribe so you do not miss future videos like this. Share this with someone who needs to hear it. Maybe a parent, a friend, someone you care about. Remember, talk to your doctor before making any major changes to your health routine. But do not wait to take action. Your kidneys filter your blood 24 hours a day. Take care of them, and they will take care of you. Thanks for watching. I will see you in the next one.